revenue as part of the solution to balance the budget, along with some responsible, very careful cuts.
Okay. I'll ask you guys both, from a political standpoint, I'll ask you each this question, and I'll start with you, Senator Nelson. How could a government shutdown hurt the Republican Party in Minnesota?
Well, as I said earlier, I think a government shutdown will hurt all Minnesotans. I do not think it's the course of best choice. I think what we really need to look at, and we really don't even probably need to rehash all the political and policy and bills that we've been working on for the last 5 months. But I think what's missing here is we really need to start looking at solutions. How are we going to move forward here? Now, can we avoid a government shutdown? I think we can if both parties want to avoid a government shutdown. There are options. There are enough moving parts that we can avoid that. Now, we're almost running out of time. There comes a point where even when you get the agreement in place, there just isn't time to avoid that. But the real thing we need to be focusing on here is what is it that we can do to avoid this? And I think there are a number of moving parts that address the issues and also allow both the governor, the DFL, and the Republicans to not supposedly cave in.
Sure.
Compromises about everybody working together.
Right, and that's a question that I was going to get to too. But we've been hearing about this budget deficit. We talked about it last year, and about how this is going to be the year where the pain is really felt. And so I think viewers at home, they're starting to see that pain on the horizon. And so my question to you is, I'll start with you, Senator Nelson, then I'll go to you. Who will feel the pain? And this is a tough question for a politician to answer, because I think it makes people makes you actually say something that's real in terms of what's going to happen when these budget cuts, or whenever this budget is dealt with, when the ramifications actually hit the public. But who will feel the pain? And I'll ask you both, who will feel the pain most under the Republican plan, do you think?
Under a Republican, if the governor had signed the balanced budget that we gave him, the largest budget in the history of our state, $3.8 billion of new spending, I do think there would be folks who would not, and there would not be the increase that was expected. So it's a reduction in the increased spending. And the place that I thought probably would have received the greatest, what would we call pain, or the greatest challenge, would really be higher education. And it is true that higher education costs have been escalating at a pace that doesn't fit. It's really interesting. It doesn't fit with state aid and how state aid has been variable, and nor does it really track with inflation. So there's something else going on there. We don't know if it's supply and demand. We don't know if it's administrative. It's just hard to say what it is. So I think higher education would have felt really the most.
And that would have been college students in terms of.
Well, it wouldn't be college students under the Republican plan. The Republican plan actually capped tuition, put a cap on tuition, and it also added more money to the state grant program, so that state grants based on need. It's a need-based formula, and it also protected the child care piece of that, so that women can go to school. So, but I think it would have been challenges to the institution. I think there's no doubt about that.
Okay, and then Representative Norton, who would feel the most pain under the Democrats' plan?
Well, the Democrats' plan is a balanced approach. Everyone would feel a little bit of pain, but under the Democrats' plan, it would be felt across the spectrum. The Republican plan, in my opinion, and in many people's opinion, hurts the working class, the middle class. The cuts many of them hurt the poor. And in fact, budget through budget and higher ed, as Senator Nelson was talking about, as well as Health and Human Services and many of the other agencies, all hit the same people. And so it's that working middle class and poor, disabled, and elderly that keep getting hit within each of those budget areas. And Not that those folks won't feel some pain under the Democrats' plan, they will, but they're going to feel less pain, and the responsibility will be shared with those that have the most money, that top 2%. The governor's plan is that the top 2% will pay their fair share of taxes, an amount similar to what most of us in the middle class get taxed. So it's a shared opportunity, if you will, to help the state out. And that's the difference between the two plans. One is where the brunt of the pain is felt, and one is a shared responsibility for a solution.
Well, I have to say, though, I'm not really sure what what the governor's plan looks like, what plan you're talking about, because the only plan the Democrats put forward was the governor's plan, which got 1 vote out of the entire legislature. That was his only complete budget.
We voted in the House. That may be
oh,
true
that's
in the
true.
Senate.
You did on
House,
his
and it passed
updated.
on
That's
a
true.
purely partisan vote, but it did have every support of every Democrat.
Excuse me, that's right. The Senate has not seen, or the DFL Senate hasn't put up that plan yet. So we have not really seen what that is. But regardless, we really need to get on to solutions, I think. And we need to look at avoiding
absolutely,
the shutdown.
and I understand that. And one thing that I would like to ask you guys is that no bill is perfect, no budget is perfect.
Absolutely.
I would like each of you to share with me one part of your party's bill that you don't like. And I'd ask maybe something other than higher ed if you have another idea.
Sure. Well, you know, I voted against my party's bill for Health and Human Services. I think I was the only Republican in the legislature probably that voted against that bill. There may have been someone in the House, I'm not sure. I know I was the only senator, the only Republican senator who voted against that. And I'll tell you why. There was a real concern. There were some things that came, the bill goes off the Senate floor and it goes off the House floor and then it gets to conference committee and then it comes back. And when it came back, it had picked up something that hadn't been discussed, a lot of things actually, that hadn't been discussed in the Senate that I thought was very damaging to my district. Actually, I think it was very damaging to the state. And that was, there was a new way of payment based upon how they defined high-cost providers, yet there was no definition of what a high-cost provider was. And the ramifications of that was it would have cost this community and the state's largest private employer $60 million. And I absolutely did not feel comfortable voting for something that in my mind had not been vetted very well. They couldn't define what a high-cost provider was. If you look at Mayo Clinic in the overall scheme of illness, it's a low-cost provider. If you're looking at individual procedures, it might be considered a high-cost provider, and they had no definition for that.
Is that still in or no?
Yes, it passed. Even with voting against it, it is still in the current proposal.
Okay.
And I would say, Donnie, that both in the Republican plan and in the governor's plan, I'm uncomfortable with the Health and Human Service section. Probably that's of most concern to me. The Governor Dayton's budget also has significant impacts, negative impacts on hospitals. Mayo Clinic's 2 hospitals, Methodist and St. Mary's, are one of the top 4 hospitals impacted to the tune of between $35 and $40 million with his part of the bill. And the Republican, as Senator Nelson was describing, also has significant impact. And their bill also contains the stem cell research and kind of AKA cloning bill that will impact Mayo and business and biobusiness development in the state of Minnesota as well. So that Health and Human Service component is really important for this part of the state, and I think that's why we focus on it.
Okay, so that's something you both agreed on. Okay.
Actually, there's probably many things we agree on, and those are the things that we need to focus on.
Okay, what's happening at the Capitol? I know you guys are, people aren't necessarily up there full time the way they are during the session, but you guys have got to be hearing from your people about what's happening in terms of phone calls. I talked to a guy yesterday, he's a state employee, and he said, I call every other day.
Yeah.
What's going on with the phones up at the Capitol?
Well, I can tell you there are meetings ongoing with the governor. There's a regular schedule, so those meetings with leadership are going on, and then each of the committees is meeting with their leads as well. As I understand it, not a lot of progress is being made. the larger issue has to do with budget targets. The perhaps secondary issue has to do with policy and the amount of policy in the bills and what can we live with and what can we can't at a final solution. So those meetings are going on, but at the same time there is a planning going on by the departments and others. What happens if, the what if we can't, even if we get a decision but the paperwork can't be done in time or you can't pull people together and the government does shut down on July 1st, what happens to the employees? And there's a lot going on with our state employees, our counties, our cities, eventually our school districts that needs to be addressed. Healthcare for workers, when there's no one to cut the check to the healthcare insurer, what happens? Can we write our own check and send it? And for folks who aren't getting a paycheck, can they afford to write that check and send it on, maybe beyond a month? So there's a lot, there's kind of two levels of discussion going on right now.
And
I was, excuse me, I was at the Capitol on Monday. I was called at 8 o'clock Saturday morning asking if I'd come up and meet with the governor to go over the education bill. That was the first bill through this schedule of meetings that they agreed to. And actually I rescheduled a number of things here in Rochester, inconvenienced a number of people who were planning to meet with me and boards that I was on. And unfortunately, the governor didn't show up at that meeting.
Well, as we
So
all
that
know,
was
it's
tough.
the commissioner that does the negotiating, not the governor.
Well,
so-
actually, she said she couldn't negotiate. But anyway, so the point is,
She's there.
unfortunately, some of those meetings, we need to get the people in the room that are making the decisions, basically.
Yeah.
But I do hope before we run out of time, Ronnie, we can look at what is it that we can do to resolve this issue. Maybe that's going to be your last question, but we definitely need to talk about how is it that we can put forward a budget that the governor can sign and that the people of Minnesota can live with. I will say also this week, the Republicans, I wasn't up here on this particular day, I think it happened on Wednesday, I think it was Wednesday, the Republicans sent a compromise to the governor saying we will match all your spending in education and public safety. So kind of kids, cops, and courts basically would be at the governor's proposal, about 50% of the budget. And it said it was a significant compromise. He'd weigh in on it. I haven't seen this morning's papers yet, but there's been no comment. And so, if we can just maybe start taking and getting some of these budget bills signed, it would help in the shutdown. In 2005, there was a shutdown, but it was a partial shutdown. Some of the bills had been agreed to, and so those departments continued to run.